Did you know that the position or the way that you're sleeping could be making your snoring or sleep apnea worse? It could even impact how much oxygen your brain is getting when you're sleeping. In this video, I'm going to talk about the best and also the worst positions for your airway health, how you're breathing when you're sleeping. I'm also going to talk about, if you do have some of these bad positions, some tricks you can do to help fix it and at least improve your breathing. The way you breathe when you're sleeping is so important, and a lot of people do not realize how it can affect not just how they sleep, but the rest of their day. Because if you don't sleep good, then you're not going to function well the rest of the day. Your brain's not going to function as well. You're also more likely to be moody, more irritable, struggle in school, struggle learning new things. So it really makes a big difference. There's certain things or certain positions people do when they're sleeping that can kind of obstruct their airway or their breathing tubes. And certain sleeping positions for certain people can cause their tongue to kind of cut off their breathing, or their soft palate to cut off their breathing, or to start snoring at least. And in these cases, when this airflow is restricted, or you have this turbulent breathing where it's harder to breathe, you're going to get less oxygen. And also you're going to create more stress in your body, you're going to create more inflammation, and this can lead to a chronic problem. If this just happens for one night, no big deal. But if it's a repetitive thing, if this happens over and over, and your body's trying to fight to breathe over and over, it's not just going to stay like that. It's actually going to get worse. What studies are showing is that this constant stress of trying to breathe can create this chronic stress, this chronic inflammation that progressively gets worse over time. You know, when you think about it, people don't just wake up one day with sleep apnea. It's a condition that develops and gets worse and worse over time. So if we can start nipping it in the butt earlier, that's going to go a long way in how healthy you are later on in life. So I'm going to go over a couple of the worst positions. So the first one I have is back sleeping, or sleeping on your back. Now, sleeping on your back isn't bad for everybody, but for certain people, I would avoid it. The reason that sleeping on your back could be a problem is that it can cause your tongue to fall back and constrict your breathing. Why? Because of gravity. But if someone is sleeping with their mouth open, their tongue will tend to fall back and constrict their breathing. And as their tongue falls back, their soft palate, or where the roof of your mouth is, the back part of the roof of your mouth, can start to vibrate. And this creates that snoring sound. But it's a huge indication that your breathing is getting constricted. Now, if this tongue completely goes back and completely cuts off the breathing, this is sleep apnea. You're choking in the middle of the night and you can't breathe. And eventually you will wake up, and then you will catch your breath, and then you'll go back to sleep. This can happen multiple times throughout the night. And if this happens to you, then you're going to get very little deep quality sleep. You're going to sleep a good 8 hours, but you're not going to feel well rested because that sleep is going to be fragmented. You're going to keep waking up. You're not going to get to the later sleeping stages. One full sleep cycle is 90 minutes. So you have to stay asleep for those full 90 minutes to get that one sleep cycle. But if you keep waking up in the middle of those sleep cycles, you're going to miss out on a lot of that quality sleep. So ideally, if you're sleeping on your back, you should be breathing in and out of your nose. Your nose is a great filter. It filters out a lot of bacteria and viruses and dust and particles, and it keeps that nasopharynx area, or that area in your throat, very clean, because it also produces a molecule called nitric oxide. Nitric oxide is a vasodilator and an antibacterial. So it'll keep your tonsils and your adenoids clean and also smaller. Your tonsils and adenoids are also in the back of your throat. And if they're very large and swollen, then you're going to also have a hard time breathing. So this is why breathing in and out of your nose is so important. And you also want to have proper oral posture. And this, again, is more likely if you are a nose breather. So your lips should be closed, your teeth should be slightly touching, and your tongue should be resting against the roof of your mouth. Not just the tip of your tongue, but also the middle and back part of your tongue. It should kind of be like a suction, with your tongue suction against the roof of your mouth. This is basically perfect mouth posture. And if someone is sleeping like this, there's no problem with them sleeping on their back. This is very healthy. But oftentimes you'll find someone sleeping on their back, and instead of their mouth being closed, their mouth is wide open, and they sound like they are gasping for breath, or they're snoring so loud and so obnoxiously. I can definitely think of a couple people like this. So if this sounds like you, what can you do? Well, one solution is to use a mouth tape. Literally just take a piece of tape, tape it over your mouth. The tape that I like to use is something called 3M micropore paper tape. It's literally a medical grade tape that you rip off a piece and tape over your mouth. There's also a bunch on Amazon if you want to look there. But you also want to train your tongue so that it's not falling back. And this is something more along the lines of something called myofunctional therapy, where you're basically trained to train your tongue muscles and your lip muscles to have proper posture, and this was really going to help your sleep. But I did make some other videos on how to properly train your tongue, and I'm putting a link in the description below where I go over some tongue exercises. But the biggest thing is just focus on that oral posture all day long, with that mouth closed, those teeth slightly touching, and that tongue against the roof of your mouth. The other thing to note when you're sleeping on your back is you don't want a super high pillow, because you want your neck to be in line with your spine. So you might want to look into a shorter pillow if you do have a super tall pillow. Something else to keep in mind when you are sleeping on your back, either you might be doing this or you might catch someone else doing this, is you might tilt your head up or tilt your chin up. This is a natural mechanism we do to basically open up our airway. Think about in CPR. When you're doing CPR and you're giving rescue breaths, we are trained to tilt that chin up, and this opens up the airway. And your body naturally does this when it senses that its airway is constricted. So if you're sleeping on your back, you could be tilting your head up, and then you could be waking up with neck pain, wondering how I slept, but it could be because of that. And this again goes back to mouth breathing, because as soon as your mouth opens, that jaw starts to constrict. Because when you open your mouth, that jaw ever so slightly moves back. Your mandible starts to shift back and cut off your breathing a little bit. So then you're more likely to have to tilt that head up of yours to keep that airway open so you can breathe all night. Now, the second bad sleeping posture I want to talk about is stomach sleeping. Now, you might think that stomach sleeping can prevent snoring and prevent sleep apnea because now you don't have that risk of that tongue falling back, but it does put a lot of stress on the neck and the spine. And also when you're sleeping on your stomach, you have to turn the head. So it's not an ideal position, and it's still going to limit your oxygen intake. Now, the best sleeping position, the one that I would recommend, is a side sleeping position. Here you kind of get the best of both worlds, because you're still protecting that airway. Because let's say you do end up breathing through your mouth, that tongue is not going to fall back to the back of your throat. It's going to more fall towards the side. There's a less chance that it's going to cut off your breathing. So if you're someone that you know that you're going to struggle breathing through your nose and you can't tape your mouth shut or anything like that, try side sleeping, because then at least if you do resort to mouth breathing, then you don't have to worry about your tongue falling back as much. The thing to note with side sleeping is you might want to get a taller pillow now, because now that you're on your side, again, you still want your neck to be in line with your spine. So instead of being on your back, where you want a shorter pillow, with your side, you might want a taller pillow. The second good sleeping position I like is a slightly elevated back sleeping position. So you're still on your back, but there's a way to slightly tilt that back up. Sometimes you can get a mattress that is actually adjustable, where you can like move it up or down, or sometimes you can be a little creative and wedge some pillows slowly on your back so that you're elevated a little bit. This can again reduce the risk of that airway collapsing. By collapsing, I mean something going back and obstructing that airway, whether it's your soft palate or your tongue or whatever else. So this study was actually looking more in depth on this. So they had people elevate their bed just a few inches, about 7.5 degrees. And they were specifically looking at patients that already have obstructive sleep apnea. And the researchers noted that tilting people 7.5 degrees in bed reduced their sleep apnea severity by 31.8% on average. And this incline level also reduced shallow breathing and improved sleep efficiency. So for people that had sleep apnea, this made a big difference. It made them sleep better. It also reduced their snoring and their sleep apnea. So if you're someone that you know you're gonna have to lie on your back and you're gonna have to breathe through your mouth for one reason or another, try at least elevating that sleeping position so you're not lying flat on your back as much. Now, we do wanna go over a couple other sleeping aids and other things to improve your sleep. If you do have signs of sleep apnea or trouble breathing through your nose, you do wanna talk to your ear, nose, and throat doctor and possibly your allergist or your doctor about ways to help fix that so you can breathe better. Now, we did actually make other videos on how to really improve your nasal breathing and how you can basically switch from mouth breathing to nose breathing. So I'm putting a link in the description below if you want to learn more about that. But you might also need a device like a CPAP machine or something like that to help improve your breathing when you're sleeping. So really important to get a sleep study if you are concerned. Some other simple things you can do are using a nasal dilator or again, a mouth tape. I talked about the mouth tape already, but a nasal dilator is literally a strip that goes over your nose that kind of opens your nose a little bit so that it's not as constricted and it's easier to breathe in and out of your nose. There's also an internal dilator you can get. The brand I like is something called Mute, which is literally just a clip that goes on the inside of your nose, and you can crank it open. You can even crank it more open on one side if one side of your nose collapses more than the other. These are just a couple simple things you can do. You can also try using a nasal decongestant spray at nighttime to help open up the nose and help you sleep. Anyway, thank you guys for watching. Let me know in the comment section below what position of sleeping you like the best. And as always, hit that thumbs up button and subscribe to my channel below. I'll see you guys in the next video. Can swishing oil in your mouth really be the key to improving your dental health? Some people make the claim that swishing coconut oil in your mouth or oil pulling can be the key to fixing cavities and preventing needing fillings or other dental treatment. And some people even say that you don't even need to brush and floss if you do this. So oil pulling really